So with that as a kind of an overall foundation, for what we're seeing really with with meditation and seniors mental health in general, the research is very positive. So the research is very positive and promising with regards to mental health improvement and through meditation. So for many people on here who practice meditation or who are interested in working and doing this, it's very positive. And for those who've been practicing for many years, then you've been reaping the benefit of this. And what I was hoping with this presentation is that it can also be a foundation to encourage seniors to incorporate meditation into their daily practice, into their daily lives. The thing about meditation and meditation practices is the research is actually showing that there are actually limited side effects or no to none side effects of actually practicing medication as opposed to taking certain medication. The only cases that, based on my experience, I could share where there could be side effects is if people are doing too many strenuous activities or they're sitting for meditation for too long and they're potentially injuring their body. That could be a side effect. So as long as you're not forcing yourself to meditate, and also there's the psychological aspect of meditation. If you're not too stressful on yourself to focus and meditate, then meditation is an option to improve our health without major side effects that you could have with medication. A couple of things I want to talk about, which is more for future research. An area of future research which would be amazing for it to happen would be a focus on Arka Dhyana intuitive meditation and understanding the impacts of that on health. And I want to focus a little bit now as I'm wrapping up on Arka Dhyana intuitive meditation and some of the research that already existing and what it says. So the first research that I want to mention, it's pioneering research that was done by Dr. Tina Linhart, a PhD. She's also the president of CCA Spain. And I just want to call attention to this article, and it was called Unlocking the Secrets of the Heart Through Meditating on the Self. And Dr. Linhart performed this study where subjects were studying Arka Dhyana, and she recorded the results. So I do recommend you take a look at these results. I would like to bring forth some information from one of her more recent papers. This is called Surfing the Deeper Levels of Consciousness, Emotions, and Mental Health. And in reading this abstract, I found something very interesting that I think can be a part of the future research with Arka Dhyana. One of the things that Dr. Linhart mentions here is that many mental health disorders can be linked to emotions, and that emotions are kind of a foundation or kind of a source for the mental health. And that if we look at emotions and repressed emotions, and we are able to have solutions at that level, it can come to the more mind and thinking level, so not the emotional level, but the mind and thinking level, and potentially have healing or have results there that can help with mental health. And the reason why I called upon this is I think it's very fascinating. So in my previous research and what I've been talking about, it's been much at the mental level and the mind level and studying it from this perspective. But this research is taking a different approach, which is looking at it from a more emotional level. And to help illustrate that, I'll briefly talk about this is from the Srinivas Arka's book called Arka Dhyana Intuitive Meditation. And in that book, Srinivas Arka mentions the 6 main levels of consciousness. And so the 6 main levels of consciousness, based on his experience and philosophy, there is the mind consciousness, subliminal mind consciousness, feeling mind, emotional heart, the heart soul consciousness, and pure self consciousness. So my interpretation of the previous research by Dr. Linhart here, and I think how it can be applied for the future, is if we look at the studies that I've talked about, they will fit in more into the categories of number 1 and number 2 here. So the mind consciousness and the subliminal consciousness. But if emotions are truly rooted more at the feeling mind level, and let's say the emotional heart level, then in order for us to deal with these anxieties and issues, we need to be focused more on the emotional heart consciousness level to be able to have a better experiences and healing at that level. And then those experiences can come to the mind level and help to bring peace, reduce anxiety, reduce depression. So ultimately, in putting together this presentation, I wanted for this to be a kind of a foundation for potential research in the future, and to bring that positive approach to the mind, health, and potential for seniors. Before I wrap up, I want to just share a few things that I've added on this PowerPoint for you all. This PowerPoint will be available when we launch this module, so that you'll have access to this whenever you want. I created a list here of articles of interest because there's so much information out here, and I only have a really limited amount of time to speak with you all. I couldn't talk about everything, so I only picked what was relevant from a seniors health perspective. But I added a few articles that could be of interest. So there's articles, various articles. I won't necessarily read each one of them, but they talk about meditation and how it's helping to improve your mental health from a brain perspective. So the effects that it's having on cortical thickness, the effect on the brain and regeneration of cells. So very fascinating, interesting things. I have these articles here for myself as well for future reading, because due to time constraints, I haven't been able to get into the detail. So it's also reminders for myself as well. I've also added a couple other here based on the study of longevity for seniors with meditation. This is specific to transcendental meditation and their longevity. I've added here about social participation and well-being for seniors. So for the seniors who are on here and you're attending a webinar, you're attending online sessions, Zoom sessions, that's excellent, because it's difficult to meet in purpose. But this kind of social participation and trying to interact however you can, even if it's not in person, is an excellent way to help with your mental health. I've also added here a list of glossary. In doing this presentation, I also learned a lot myself, so I put notes down here for some of the key terms. So you're welcome to go through. Some of these terms are a little bit deep into psychology, which is not my background, so I didn't want to get into too much details here in the presentation, but I've added some of these information here based on, the anxiety disorders, some more information on depression, and then a glossary just kind of talking about bipolar and some of the information that I found online. So yeah, this is my presentation overall.